The eye is made from soft but strong tissues and needs to maintain shape so it can focus. To achieve this, clear fluid, the aqueous, is pumped into the eye from the bloodstream. This fluid circulates around the structures of the eye, nourishing the lens and the cornea, and it also removes unwanted debris. It then exits through a drainage system, which is a sieve-like system called the trabecular meshwork, back to the blood to be renewed. Glaucoma is the name given to a group of eye diseases in which the optic nerve at the back of the eye is slowly destroyed. When the drainage system doesn't function correctly, it becomes clogged. The fluid can't filter out of the eye at its normal rate, and therefore pressure builds up within the eye. Glaucoma has many causes, but in almost all of them, reducing the eye's pressure will generally safeguard the patient from progressive damage. So, the ultimate aim of treatment is to minimise visual field loss, your peripheral vision, by lowering eye pressure. Ophthalmologist Dr. Guy DeMello explains the various forms of glaucoma.
Thank you. There are several main forms of glaucoma, but they all have in common progressive damage to the optic nerve. Different types include low pressure or normal pressure glaucoma, where the pressure may seem to be normal but there's damage to the optic nerve, acute or angle closure glaucoma, congenital glaucoma, and secondary glaucomas, which can develop as a result of other disorders of the eye, such as injuries, cataracts, and eye inflammation. But chronic or primary open-angle glaucoma is by far the most common type. It has few symptoms until much of the eyesight is lost at a late stage. Damage often progresses very slowly, with vision gradually fading, like this. One eye covers for the other, and the person remains unaware of any problem until many nerve fibres and a significant part of the vision has been destroyed. This damage is irreversible, which is why it's so important to detect the problem as early as possible, to be able to start treatment with as little damage to the vision as possible.
While glaucoma is more common as people age, it can occur at any age, and some people are at higher risk than others. Those with a family history of glaucoma, diabetes, migraine, short-sightedness, myopia, previous eye injury, blood pressure problems, prolonged past or present use of cortisone drugs, steroids, and some ethnic groups are also more prone to glaucoma than others. People in these groups should have their first eye check no later than the age of 35. And for most people, it's recommended to have an eye check for glaucoma by the age of 40, because regular eye examinations are the best way to detect this eye condition early.